We are now joined by Dr. B, Dr. Brent Wallis, the Chief Medical Officer of People's Health. Good morning, Doctor.
Morning, Dave. How are you doing?
Well, here in Southeast Louisiana, we have clearly been blessed for the last few days with Hurricane Marco literally petering out and falling apart, and with us not even seeing any rain yet here in Southeast Louisiana other than a few very light showers from Hurricane Laura. But there are still issues for folks, clearly, not only here in Greater New Orleans, but across our state. And one thing I wanted to ask you about, with so many people having to evacuate their homes in Louisiana, with so many people displaced, going to stay with friends and relatives, going to be sheltered in hotels, and with so many pharmacies that are closed now as a result of the hurricane, it makes me wonder about people and their abilities to get their medications and to continue to take their medications. They're out of their normal routines. And what happens if folks miss a dose or get off of their schedule? Those are issues that I think always come up when we have situations like this, aren't they?
Yeah, definitely. It's something we're very concerned about. That's why when you're preparing for a storm before it actually hits, one of the most important things to do is make sure that you have all your medications. Most health plans actually allow you to refill your medications early so that you can have a supply to take with you if you have to evacuate. And, it's very important because if you stop taking your medicines, then your health conditions can worsen, and that can result in a long-term decline in your health, or even worse, could lead to hospitalization. So it's very important that you make sure you try to keep with that routine, especially in a situation like this.
Yeah, because everyone's out of their routine. They're staying somewhere else. They're sleeping on different patterns. They're doing things differently. And that can be really challenging to remember to take your medications at the same times and in the same intervals that you normally would. And, I don't know about you, but I have trouble remembering what day it is when we're going through things like this. And so then you go to the medicine cabinet and you're like, wait, what day is it? What time is it? And you're looking at your little pill box and trying to remember what day you took your medicine and didn't take your medicine. But it's really important that people try as hard as they can to take those things as they're prescribed.
Yeah, definitely. And, there's a few things you can do to help with that. You do get out of your routine pretty quickly, especially if you have to leave your home. And so, there's a couple of tools you can use. Pill boxes actually can be very helpful, so, that have the days marked on them. So that way you can check and see if you actually already took it for that day or you missed a dose and then catch up. There's also some great apps for your phone. Everybody's got a smartphone for the most part now. And so you can download these apps that actually will remind you to take your pills when you need to take them. And that way you can try the best you can to keep up with that routine.
Yeah, and I always wonder, and maybe you can help us out with this, if you miss a dose of your medicine, if you were evacuating, if you overslept, if you got confused, if you miss a dose of your medication, should you wait until the next time you're supposed to take it, or should you go ahead and take it right then?
Yeah, for most medications, you go ahead and take it then, depending on how long it's been. If you're on a medicine that's once a day for certain, you go ahead and take it when you actually realize it. If you're on something that's dosed more frequently, 2 or 3 times a day, you really have to kind of look to see when your next dose is due. You certainly don't want to double up on most medications because that can have some adverse effects. And then diabetics in particular need to be pretty careful because some of the medicines they're taking directly affect their blood sugar, kind of from hour to hour after they take the medicine. So in those cases, you may want to reach out to your physician or even the pharmacist to talk to them about whether or not you should take your medicine or you should wait till the next dose.
We're talking with Dr. B, Dr. Brent Wallis, and we'll continue the conversation here on WWL right after we get you updated on traffic as our continuing coverage of Laura continues on. Talking with Dr. Brent Wallis, Dr. B, the Chief Medical Officer of People's Health. Dr. Wallis, right now is a time when we're seeing a lot of people struggling, and now you throw a hurricane on top of that, the cost of evacuation and relocation, the cost of having gone through a pandemic and many people struggling financially as a result of that. We're hearing some people ask, my medications are really expensive. What if I can't afford them? What are some options for people who feel like their medications are too costly for them to get refills?
Yeah, it's a huge problem, and the cost of drugs keeps going up year over year. And so if you speak with your doctor, there are a lot of options. In particular, a lot of medications have generic equivalents, and generic medications are always less expensive than the brand medications. And so sometimes they can actually create a regimen that provides those lower cost medications, and sometimes they can even combine two pills into one pill that may help your daily routine a little bit more as well.
And further than that, if someone has a parent who is on original Medicare, they don't have drug coverage at all, right? What are their options?
Yeah, so original Medicare doesn't cover drugs, and that's why the Part D plans were created. And Part D actually specifically covers medications. You can actually buy that separately from your normal Medicare insurance, or most Medicare Advantage plans like People's Health include prescription drug coverage. And so what that allows is it allows a copay for the medications rather than paying full price for them. What's nice about some of the Medicare Advantage plans like ours is that a 90-day supply of what they call Tier 1 and Tier 2 drugs, which are usually the generic drugs, are usually a $0 copay. So that can be a really big help to your finances, especially in times like this.
I've heard, though, about when you talk about Part D, there's also something called the donut hole. What is that, and what do people have to know about that?
Yeah, the donut hole is it's part of the design of the plan, and what happens is a portion of the payment for the medications actually increases throughout the year. So what happens is there's a gap, just like there's a hole in a donut, and this year it starts at about $4,000 and lasts to about $6,000. So what that means is if your medications overall cost up to $4,000, once you enter that donut hole, you actually have to pay more of the cost for the drugs until you reach the $6,000 mark. So what's nice about some of the Part D plans and the Medicare Advantage plans is if you stay on those generic drugs, if that's appropriate for your condition, those Tier 1 and Tier 2 medications are covered through the gap. So because they have a $0 copay, even though you're in the gap, you're still able to get those without having to pay anything out of pocket. So that's another reason to look into those.
Dr. Brent Wallis, we appreciate you joining us here on WWL and all this valuable information, because we know a lot of people are struggling right now with taking their medications, taking them within the routine with everything else going on, and now an evacuation on top of that, and, of course, all the expenses that are always associated with medication. How can people find out more about People's Health?
Sure. There's a lot of information on our website at peopleshealth.com, or they can call us at 855-821-2666.
Dr. Brent Wallis, we look forward to talking to you again next week. Hopefully the weather's better when we do that. And the good news is there's nothing else on the tropical map we got to worry about right now. A little wave coming off of Africa with a 20% chance. So hopefully we can get back into a more normal routine before we talk to you next week.
Hopefully so. Stay safe, Dave.
Thank you. Dr. Brent Wallis from People's Health here on WWL.